Have you noticed your child is struggling, or you may have some concerns for your child meeting developmental milestones? Well, listen up. Let me tell you that early movement support can make a huge difference for your child. Hello, my name is Michelle. I'm a pediatric physical therapist at Easter Seals, where we treat kids anywhere from ages 0 to 3. As a physical therapist, we assess and evaluate your child's gross motor development, muscle tone, muscle strength, as well as their posture and reflexes. So after the evaluation, as a team, we develop goals. With these goals, we provide treatment that is based in your home in the most natural environment. We do not need any special equipment or tools to be able to conduct these treatments. Whatever you have in the house, whether it's boxes, diaper boxes, Amazon boxes, kitchen utensils, kitchen Tupperware, blankets, pillows, anything that is accessible to us, we become very creative together and we make things work for treatment. So now you may be thinking, so when should I seek out physical therapy? Well, if you have noticed that your child's eye movement is not coordinating together between 4 to 7 months, if your child is not rolling by 8 months, or your child's not sitting up with a good posture by 8 to 10 months, if they're not crawling on hands and knees by at least 10 months, and if they're not walking or standing on their own by 15 months. Things that you can look for in your child is if they're sitting, having a head tilt, or when they're laying down, if you notice that their head may be tilted, or they're only looking in one direction more than the other, they prefer everything to one side. That is also a good reason to look for physical therapy. A lot of the times what happens is we maybe get some tightness, some weakness, and we can help you with that. Other things is if they're laying on their back and you start to notice some flattening on one side more than the other, that is also another reason, because we can help with positioning, showing positioning stretches to help alleviate the pressure being placed on the head, which can be rolling to the other side, putting a pillow behind, just to give some of that time off the back of their head. Other things are they're not tolerating tummy time, so they're wanting to be more on their back. It's too hard, gravity, it's a nightmare. So we can prop them up on a pillow, a little bolster, roll up some towels, put them up. A lot easier for them to come up, pick up their head, be more engaged with the family, anybody that's in sight. A lot more tolerable, a lot more easier on the muscles as they start to get stronger. Another thing, as they crawl, if they're crawling and you start to notice that their crawl, they are not on hands and knees, they have one leg coming up, there is some muscle tightness, some weakness, so they're compensating. That is another reason that we can help you and teach you some exercise and activities to help that. One more thing that you may also notice, say your child's not walking, but they're walking and their leg is turning out, and you're having some concern, their foot is falling in. Well, we can also help you some recommendations on getting braces for better foot alignment that can help support the ankles to help the foundation of the child's structure and muscle growth. Putting a foundation of support at the ankles helps build the hips, trunk, and head as we're in a better setting. Same thing as you have a foundation for the house. If you have a wobbly foundation, you have a wobbly house. So these will just go on like that. You get the support. Voila, they're standing nice and straight. If your gut is telling you something is off with your child, or you just feel that you need some support on helping your child develop, seek us out here at Easter Seals, as we can help pave the way for lifelong success.